We've got a really interesting interview today with Dr. Scott Sherr, who has a wide, diverse view on so many interesting topics that we're going to go over, specifically some of the neurotransmitters like GABA and serotonin. And he is an expert in hyperbaric therapy. So we talk a little bit about that and the benefits of carbon dioxide. You're going to love this one. So hope you enjoyed as much as I did.
I work with people all over the world, and I work with clinics all over the world using hyperbaric therapy as kind of like the fulcrum or sort of like the main focus point of what I do. I then gravitated towards a colleague of mine that was working in a foundational approach to medicine called Health Optimization Medicine in Practice, which is an educational platform. It's a nonprofit that's training doctors and practitioners, including myself, on how to optimize health. And from there, I've kind of delved into multiple things, including neurotransmitter balance like GABA. The GABA deficiency is associated with so many things. It's associated with anxiety, with fear, with depression, with a short temper, with phobias, which are fears, impulsiveness, disorganization, addictions, and it's even associated with schizophrenia and OCD. And then not only just mental health symptoms, but you can have things like IBS and diarrhea, hypertension, tinnitus, chronic pain, migraines, allergies, frequent urination, flushing, sweating, salt cravings, muscle tension. These are all things that could be signs of GABA deficiency. And many of the people listening here may have been prescribed an SSRI, for example, for some of these symptoms, but it may not have been related to a serotonin deficiency. It's actually, we know that depression is not related to a serotonin deficiency. That's been well studied over the last several months to years now. If we can actually enhance and balance the GABA system, we can truly see a significant shift in the health of our patients and clients. And I've been seeing this in real time.
Welcome, everyone. This is Dr. Mercola, helping you take control of your health. And today we're joined by Dr. Scott Sherr, who is going to enlighten us about a variety of different topics, including GABA, or gamma aminobutyric acid, which is a really great topic, especially if you struggle with sleep and a variety of other disorders. It's quite converse to serotonin. It's almost like the direct opposite. It's what you need, is not serotonin is what you don't need. So welcome, and thank you for joining us today.
Thanks, Joe, for having me. It's a pleasure to be here. Yeah, GABA is the unsung neurotransmitter. It's the one that doesn't get a lot of press. The fancy ones like serotonin and dopamine and norepinephrine get all the press, get all the news. Everybody cares about them, but they don't realize that GABA is 20% of the brain's neurotransmission. And when you combine glutamate, which is actually its opposite in the sense of glutamate being the excitatory neurotransmitter, and the main excitatory neurotransmitter in the brain, and GABA being the main inhibitory neurotransmitter, those two are always working in conjunction and in balance. And in fact, it's this excitatory transmitter glutamate that actually turns into GABA in the brain.
Interesting. So appreciate that background. So unfortunately, I neglected to mention your history and your background. So why don't you tell us a little bit about yourself, your medical training,
Sure.
And how you got into practicing natural medicine?
Sure. So my name is Dr. Scott Sherr. Thanks for everybody listening today. My background is I'm the son of a chiropractor. I grew up in New York, and my father's still a chiropractor in New York for over 40 years. His name is Alan Sherr, the Northport Wellness Center there, where I grew up in. So I grew up very much out of the box. There really was no box at all. And at that point, I decided to go to medical school after speaking to my father for multiple, I remember multiple weeks as I was in college and thinking about whether I would go to chiropractic school or decide to go to medical school. I decided to go to medical school thinking I could bridge the chasm between the alternative medicine, the world of chiropractic, and the conventional world that I really had no idea what I was stepping into, to be honest. So, and it was a journey, and I first really kind of I gravitated towards hyperbaric oxygen therapy, and I learned about it in medical school, and then when I was in residency, and then after I finished medical school and I went into my internal medicine residency and finished that, I created a practice that integrated hyperbaric oxygen therapy with numerous other modalities. And I also created an online platform where I do telemedicine consultations, and I work with people all over the world, and I work with clinics all over the world using hyperbaric therapy as kind of like the fulcrum or sort of like the main focus point of what I do. I then gravitated towards a a colleague of mine that was working in a foundational approach to medicine called Health Optimization Medicine in Practice, which is an educational platform. It's a nonprofit that's training doctors and practitioners, including myself, on how to optimize health. And from there, I've kind of delved into multiple things, including neurotransmitter balance like GABA. We talked about methylene blue in the past, you and I, Joe, and other things that kind of work on how you can optimize the body now while you're looking at optimizing it over the long term. So people need help now. We know that, and people are hurting and having issues that need to be addressed now. But over the long term, you can hope, and the idea really is that you can optimize health over the long term. And that takes time though. And that's foundational lifestyle, dietary, supplementation, data focused as much as possible, but you need things that can help them right now. And knowing about the neurotransmitter balance in the system is really, really important as well. So, and that's where GABA kind of comes in.
Okay, great. So you didn't learn your skill set and information about natural health from medical school. There's no way, they don't teach it there. So anyone in this field has to acquire it separately. So maybe you can briefly summarize your journey and to acquire the skill set. And then specifically at the end, discuss how you found Ray Peat and that story, because that'll be interesting. And we'll discuss that a little more, then we can dive into GABA.
Well, I mean, I think my journey really started off when I was a kid, right? I didn't look at anything as you would typically when you're going through a conventional upbringing with going to McDonald's and going to regular doctors and those kinds of things. So I've always been very much in line with thinking of things outside the box in that case. And then as I finished medical school and residency and started getting involved in hyperbaric therapy and creating an integrative approach, I just started learning more and more about what was out there and what was available and what was really necessary for optimizing health rather than, as I mentioned, just treating disease. And I already knew sort of in concept, all of that was ongoing in the sense that the way I grew up and the way I saw people heal and the way I saw people's diets change when I was a kid, and then their allergies would go away, for example, or doing an adjustment and their neurologic presentation would improve. I was growing up in this office and seeing all that. So I think for me as an adult, it was more trying to, or just not even trying, just sort of the flow of understanding how to actually do this in clinical practice with my own realm of understanding and curiosity and things like that. And so, as far as Ray goes, I'm not as into Ray as you are, Joe. I know many of his work, and I know and I appreciated all of it, but I would certainly not call myself a student of his work to a significant degree as much as you are.
All right. Well, definitely a student. I've just started learning it, but he was really a genius. Passed away about a year ago as we're recording this. So having that perspective when you went through medical training must have been a challenge. I know a few people who did that. Most people convert to natural medicine after medical school, not before, because they're so opposed to the whole paradigm that has been captured since the beginning of the 20th century, essentially, that they're not going to commit to it. They know it's fraudulent and it's absolutely opposed to what they believe. So how did you reconcile that?
Yeah, it was a challenge. I mean, I kind of put my blinders on for a little while and just did what I needed to do to get the training. And look, I think that we all can agree that there's a good reason why we all need conventional medicine sometimes. Working in an acute care hospital, for example, you need to do what you need to do to get people better. It's not like you'd want people to be there and presenting the way they are, but unfortunately they are, right? So I think that there's certainly a role for conventional medicine. I think especially acute care medicine there's a lot of problems with it, but it does do what it needs to do to get people out of the hospital. The problem, I think, is in the primary care world, in the outpatient medicine world, where things are very, very broken overall. So if you have a bleeding ulcer and you need an endoscopy and a clipping, you need to go to the hospital and get that done. And that's something that we can do very well now. What we can't do is prevent that ulcer from happening in the first place very well. And I think that's really where the disconnect is.
Conventional medicine can't.
No, conventional medicine cannot do that, right? So as a result, I mean, for me, it was knowing that I always kind of had a feel of where I was going to go with my practice and with where I was going to go overall. It was just a matter of understanding what I needed to know now. And look, and still in the acute care setting, I think that a lot of the knowledge that I've gained makes a lot of sense and still applies in a lot of ways. But the system is outside system is just broken in the conventional world, and that's why we need other systems, and we need people that are interested in getting out of the system. And you're right, Joe. Most people get out because of their own personal health challenges. That's been my experience talking to a lot of people in this world, is that doctors themselves had conventional medicine fail them in many ways, and they had to figure out their own ways out of that bubble, the conventional bubble, to actually heal themselves. And then they become involved in the alternative or the wellness, whatever, the integrative world, whatever you want to call it. And so that's not my journey, but certainly it's many journeys of those that I've met in this world.
Okay.
Yeah.
So I think you probably told me in the past that you hadn't done a deep dive with Ray Peat, and I apologize for not recalling that. I knew you knew of it for sure, and you weren't opposed to it, unlike most physicians. Well, most physicians haven't heard of it, but if they did, they would be opposed to it, as I was for over 30 years. I knew of Ray's work in the 80s. He was, just in case you didn't know, he was really, as far as I'm aware, the first professional to widely acknowledge and teach that seed oils were dangerous. In the 80s, he was doing that. In the 80s, which is crazy.
I didn't realize that. Yeah.
Yeah, he was and which is what really attracted me to his work, because he was so far ahead of his time. Most physicians who are aware that they're an issue didn't really catch on until the teens of the 21st century, 30, 40 years later. So anyway, the reason I mentioned that is that he wasn't just focusing on linoleic acid and seed oils, omega-6s, PUFAs, but his primary work was really in hormones, human hormones, and he did his PhD thesis on estrogen. And the reason I mentioned that is that estrogen. What do you have any strong positions on estrogen? Do you believe in bioidentical hormone estrogen replacement therapy, or what's your position on that, or do you prescribe it?
I don't typically prescribe it. I do work with providers that do use bioidenticals at times.
Mm-hmm. Okay, so you're not an advocate of it necessarily.
Well, I think it depends on the situation in general.
Okay.
Yeah.
All right, because it seems, for the most part, there's a very limited indication for that, if at all. I'm not convinced that there is, largely because estrogen is a contributor to cancer. It really does the exact opposite of what you want to do. The reason I mentioned estrogen is that it's very similar to linoleic acid. And serotonin is mixed in there too, because the linoleic acid and the estrogen both impair mitochondrial function, and they decrease your metabolic rate and suppress your thyroid, which is not a good thing. It's really optimizing mitochondrial function is one of the things you want to do. And the reason I shifted to serotonin before we started talking about GABA is that typically that is the happy hormone, the one that's thought to be the source of most people's depression, and the neurotransmitter that is really targeted with almost all the pharmacological approaches. The most pernicious, of course, being the SSRIs, or the serotonin uptake inhibitors, like Prozac or Zoloft. And they're very, very dangerous drugs. There is never an indication to use those in my mind. It's criminal malpractice if you understand the biology of it. In fact, you want to do the exact opposite. You want to lower serotonin. And this is why you have to be careful of taking tryptophan, because tryptophan is a precursor of serotonin. And not that you don't need any tryptophan, because it's also serotonin precursor for melatonin. But you need some, but excess is just a huge problem. So anyway, that's just what I wanted to say on that. And I guess if you make any comments on that, we can delve and divert over into GABA.
Yeah. So, I think that there is some controversy on the serotonin side, but I do agree that there's all the data that's come out over the last several years does make it pretty clear that it's not really doing anything for depression per se. And there has been unfortunately, a very significant focus on that with the drugs that we've had ongoing for many years with black box warnings. I've had friends and sisters commit suicide using SSRIs. This is in the early days. And actually, I know somebody who got that black box warning on the SSRIs themselves. So they're a big deal. And I think that what I've seen in clinical practice is that usually there's so many other ways to approach people that have depression, anxiety, sleeplessness. And one of the things that I've kind of found out over the last several years is that many of these people actually are GABA deficient. And
Mm-hmm.
that becomes a big issue. If you can actually start then approaching it from a GABA deficiency perspective, then you might see a significant change. And so I think, one of the things that I didn't realize before I kind of got into this world is that, the GABA deficiency is associated with so many things. It's associated with anxiety, with fear, with
Mm-hmm.
depression, with a short temper, with phobias, which are fears, impulsiveness, disorganization, addictions, and it's even associated with schizophrenia and OCD. And then not only just mental health symptoms, but you can have things like IBS and diarrhea, hypertension, tinnitus, chronic pain, migraines, allergies, frequent urination, flushing, sweating, salt cravings, muscle tension. These are all things that could be signs of GABA deficiency. And many of the people listening here may have been prescribed an SSRI, for example, for some of these symptoms. But it may not have been related to a serotonin deficiency. It's actually, we know that depression is not related to a serotonin deficiency. That's been well studied over the last several months to years now. We know that it's likely related to many other things. And I think one of the major components is that this significant amount of neurotransmission, the GABA. So GABA, for those that are listening, is the brakes in the brain. It decreases firing of neurons. So what happens is when GABA binds to its receptor, it prevents that neuron from actually firing. So it's usually what we would call a postsynaptic neuron. So the presynaptic neuron is firing, and the postsynaptic neuron doesn't fire because GABA is around. It actually does something called hyperpolarize in that case. And these GABA neurons are all over the brain. They're in every single location, and they actually function as something called an interneuron many of the times. And an interneuron is a neuron that's between other neurons. So you can see these cool pictures of these gigantic serotonin and dopamine neurons, and then in between it is these little GABA neurons, but they're regulating all of the firing between all of these neurons. So they're extremely important for learning and for processing and for memory and for skill acquisition. So it's not about how much you can intake in your brain, actually. It's how much you can actually stop that information from coming in, so that your body and your brain in this case can actually process it, and so you can learn and understand and have new memories and skill acquisition. So I think the big challenge, and it's a big shift for people, is like, no, this is not about serotonin. This is not about even dopamine, although dopamine is certainly a problem. We're all I think our attention spans these days are all because we're dopamine deficient to some degree, because we're all always looking for that next hit of dopamine when it comes down to it. But if we're focused on those, we forget that if we can actually enhance and balance the GABA system, we can truly see a significant shift in the health of our patients and clients. And I've been seeing this in real time, looking at the whole arc of GABA production, everything from the amino acid glutamine, which is where we start here, that gets converted into glutamate in the brain. And everybody's heard of monosodium glutamate, I'm sure, from Chinese food and things. Glutamate is your excitatory neurotransmitter. And then from glutamate, you get converted into GABA. And GABA gets only made, for the most part, the majority, like 99% of it, in the brain from glutamate. And you need the cofactors vitamin B6 and magnesium to do it. So
let's stop there for a moment, if you can, because you're a fountain of information, which is great.
Yeah.
Now, the GABA is an inhibitory one,
right.
Inhibitory neurotransmitter, and glutamate is excitatory.
Correct.
So can you walk us through, I mean, there's got to be throttles and modulations in that production of GABA from glutamate, because it can go either way, right? It can go to the excitatory neurotransmitter or can go to GABA. So what modulates that?
Right. So it's a one-way conversion from glutamate to GABA. So it doesn't go back and forth like that. Typically, the challenge will be that if you have a trouble converting from glutamate to GABA, you're going to have excitatory-like symptoms overall. So
that it just backs up. And then
exactly.
Okay, so it's not converted. Okay, thanks for. I knew there was that was my confusion. It just straight to GABA, and the problem is making sure it facilitates. And you mentioned there's cofactors.
Right. Yeah, there's cofactors, vitamin B6 and magnesium. And also there's a lot of other things that are going to affect the enzyme called glutamate decarboxylase that converts glutamate to GABA. One of the biggest ones is infection. So if you have a chronic infection or acute infection, you're not going to be able to convert. If you have chronic stress and you have chronic cortisol and glucocorticoid elevations, that's also going to prevent this enzyme from working as well. But the big things would be vitamin B6 and magnesium. And I think, as you know, Joe, most of the U.S. population is magnesium deficient,
Mhm.
and a significant are vitamin
80%.
B6 deficient too.
Well, that is interesting because if your stress hormones are elevated, you're going to decrease the production of GABA.
Right.
And
Yeah, exactly.
this is one of the reasons I exited low carb and fasting, intermittent fasting, because that's one of the side effects of that strategy. It radically raises your stress hormones,
Yeah. Interestingly, no.
epinephrine,
Yeah. Yeah.
cortisol.
Yeah, interestingly, though, the ketogenic diet does increase GABA production itself, and that's related to the ketone bodies themselves doing this. So there is some balance there, with the glucocorticoid elevations, but certainly the acute stress of intermittent fasting, for example, may be depleting your GABA reserves to some degree, and then it depends on, again, what is
Probably. Yeah.
Yeah, it depends on what is your stores of glutamate that you have already, and how well are your enzymes working to convert it over. And that's what I'm always thinking about, especially people that are not eating very much. They might not be getting enough protein in the day, for example, and as a result of that, they're not getting enough glutamine. And so glutamine is an amino acid that's extremely important for the health of the gut lining. So if you have any leaky gut, for example, or stress in the gut with infection, or even leaky brain, which is actually very common if you have a leaky gut, you're probably going to be needing significantly more amounts of glutamine to get into the body and actually convert to glutamate, because you're using all the glutamine for your colonic cells, which is the main fuel of your cells in the gut themselves. So you have to be looking at the whole picture when you're thinking about this. And the other thing is that, if you're taking GABA as a supplement, GABA supplements don't typically work because the molecule itself, GABA, is too big to get across the blood-brain barrier. However, if you have a leaky brain, they may work. So if you're taking GABA and it's working, it may be because you have a leaky brain, which sounds scary, but that just means that you have a leaky gut as well. So it's something to be aware of, that, if you're trying to enhance the GABA system, you're going to be thinking about all the aspects of the biology: leaky gut, leaky brain, glutamine production, glutamate conversion, cofactors. And then if you're looking to supplement with enhancing the GABA system, you have to be thinking about other things rather than just GABA itself to enhance the system. And there's many other ways to do that. There's herbals, there's fungals, there's even different ways of attaching GABA to other things to help it get through the blood-brain barrier too.
Well, there's some controversy on that. I mean, what you quoted was readily or widely believed in the conventional medicine community, that GABA it doesn't get past the blood-brain barrier. But there's a shift. The Brave Pre community does not believe that, and I was seeing if I can find the articles on that. But I know Georgie wrote an article on that recently, that they're promote GABA alcohol is a GABA agonist, which is one of the reasons many people enjoy it. And I'm sure you knew that, right?
Well, of course, alcohol has a high affinity for the GABA receptor. This is where benzodiazepines also will bind. This is where barbiturates and quaaludes, and those are called allosteric binding sites of the GABA receptor. So GABA binds to the receptor, and it's got all these other binding sites on the receptor where other things can bind. And that's where, so alcohol and benzos and barbiturates bind very tightly to the GABA receptor. And when they do that, it enhances GABA production and GABA function. So you have more of the inhibition. So yes, this is where you have the alcohol that's how alcohol works. But unfortunately, things like like alcohol, benzos, and barbiturates are highly addictive because they bind so tightly to the GABA receptor at their sites, and then they cause conformational shifts in the receptor themselves. And then if you go cold turkey off of those things, it definitely can cause withdrawal and even death. But certainly there's tolerance and dependence and things like that. But there are other natural equivalents that are much safer. Things like kava, for example, have been known for thousands of years to affect the GABA receptor without causing any potential addiction and withdrawal and tolerance. And it's been pretty well described there. So, and there's hanakaol, which is or hanokiol is how other people will say it, from magnolia bark. This is another one that binds to a receptor site outside of the GABA receptor itself, but actually does the same thing. It helps with enhancing the GABA production. Valerian root is another. People know valerian root. Valerian's also another one that increases GABA production in the brain, but it doesn't bind to the GABA receptor itself. It binds to a separate site, these allosteric sites. There's something called nicotinol GABA, which is vitamin B3 attached to a GABA molecule. And this is something that, because it's attached to B3, very easily gets through the blood-brain barrier and then hydrolyzes to vitamin B3 and GABA in the brain. And as a result of that, you have increased vitamin B3 and GABA directly. So that becomes a GABA agonist, also called an orthosteric ligand at the GABA receptor. So you have other ways to modulate the receptor, even if you can't get GABA in directly, is my understanding. Now, I have heard that nanoliposomal varieties will potentially work because they're attached in a fat molecule itself. And then if you take very, very high doses of GABA directly, that also may have an effect as well. But at least clinically, I've seen this in patients that they take GABA. If they have a pretty good gut overall, they don't have any effect of the GABA supplements themselves. But then I give them vitamin B3 attached to a GABA. If we give them these allosteric molecules like the ones I've just described, then they start having significant improvement, and then their anxiety and stress get better, and then they sleep better as well. And that's why valerian's been known for many, many years as a great sleep aid for these reasons, and doesn't cause the same potential addictive or risk factors, the risk of the dependence, withdrawal, and addiction that the benzos and the barbiturates and
those
and the alcohols of the world will do.
Virtually, alcohol will help because it's GABA agonist, but it destroys your sleep architecture.
Right, that's a huge thing. And then a lot of the other sleep drugs, as we know, will also destroy sleep architecture. Yeah, THC does it. People don't realize that THC as well as destroys your deep sleep. Your benzos do the same thing. Your alcohol does the same thing. And if you're taking, so you really want to be taking things that are going to enhance your sleep stages as much as you can, and not things that are going to trash it. If you're like in a real bind and you've been on like an insomnia run for days or weeks and months, and then you just need to sleep, this is sometimes a reason to use some of those drugs. But oftentimes, if you can just modulate the GABA system, you can really see significant benefit without having to do all that. Of course, you don't just do that. You're looking at sleep routines and stress and trying to enhance the GABA system and everything else. But it's definitely something to think about. You want to try to avoid these drugs that are going to screw with your sleep architecture as much as possible.
So what type of doses, when you just use GABA by itself, have you gone up to and didn't seem some of your patients didn't seem to respond to?
You have to look at the doses. I don't have them offhand to know exactly.
Typically, the typical dose is like 500 milligrams.
Yeah, I've heard people telling me like around 2,000. They maybe somewhere around there they might start getting an effect. Like usually I'm trying to remember the like 2,000, 3,000, but it takes a lot to get to the amount to get some effect there.
I wouldn't go more than 3,000 milligrams. That's 3 grams. That's a lot, but
it's a lot. Yeah,
for people. Go ahead.
And that's why I try to again focus on the what are called positive allosteric modulators of the GABA receptor. So these are things like hanokiol and valerian and kava and things that are very well described and have a very good safety profile overall.
Do you use a niacin molecule attached to GABA, nicotinamide?
It's vitamin B3 attached to it. I can't know the exact. I don't know the exact form of vitamin B3, but it's it's really great because when it goes in through the brain into the brain, it hydrolyzes. And so if you take something like nicotinamide GABA, what's nice about that is that it doesn't make you so tired. The challenge with a lot of these drugs that are GABA agonists is going to make you tired. They're going to make you, and so you might not be able to focus, for example. So, but if you have something like nicotinamide GABA, it can get across the blood-brain barrier. It can help you relax without feeling tired if you get the dosing right. So that's the nice thing about something like that. Vitamin B3 attached to GABA is a really great way to increase GABA in the brain. And of course, you can synergize it with other types of compounds to make it work better. You can potentially modulate the endocannabinoid system, the system in the brain that helps kind of with homeostatic balance. We know about cannabis now in many ways, but what we maybe don't realize is that a lot of the cannabinoids will actually affect the GABA system as well. Like CBD and CBG, they affect the GABA system. THC does it as well, but it can have a paradoxical response. So this is why some people that will take THC will get a lot of anxiety actually when they take it, is that it's actually doing something to the GABA receptor where you have the paradoxical response and actually have you have less GABA to play around with. And as a result of that, you get more excitatory anxiety and things like that. So
what does the CBD do with the GABA?
It modulates it, and it's a positive allosteric modulator, which means that it's going to enhance GABA. So this is why we're using CBD at very, very high doses. There's even a company that makes this for seizures, for example. It's a pharmaceutical drug, but it's also used in clinical practice for a lot of different reasons. But really what I think it's doing in this case, if you have more GABA around, and I think this is important too, is that one of the main things that most of us are living now is a sympathetic life, is a life that's just fight or flight all the time, and are just pounding and pounding, and don't have any time to relax, or not relaxing. And then if you have more GABA around, it's going to help you get more parasympathetic. It's going to help you with relaxation. It's going to help you with stress reduction. It's going to turn the brakes on. And so if you need a detox, you need to be in parasympathetic mode, because that's how the body's going to be relaxed, and the rest and digest and also detoxification happens during parasympathetic mode. And so CBD is something that can help with that. It can help because it's modulating, of course, the endocannabinoid system. And but at the same time, I think one of the major effects is it's because it's enhancing GABA. And as a result, if you're enhancing GABA, you're going to be more parasympathetic. It's just the nature of having more GABA around.
Interesting. Any other helpful biohacks you found for facilitating sleep, and especially in people who are prone to anxiety?
Yeah. So when it comes to looking at GABA, of course, you can look at the supplements and the compounds that we've discussed, but there's lots of natural ways to increase GABA production. I think one of the major things that has been studied is meditation and breath work and yoga. So if you are getting yourself more parasympathetic, so it's like a chicken before the egg, but you can do both here at the same time and kind of come up with the chicken or come up with the egg, is that if you learn how to relax, if you learn how to be more parasympathetic, you're going to increase GABA production. So breath work, mindfulness, yoga, HRV training is sort of a corresponding thing here, is if you're getting yourself more parasympathetic, you are going to have more GABA around. And GABA is really important for the maintenance of sleep. If you're in REM sleep and you're getting chased by a monster, you stay asleep for a number of different reasons, but GABA is one of the major neurotransmitters that's preventing you having these stress responses to running from the monster when you sleep. So you want to have GABA reduction, you need to have it throughout the evening. And so enhancing it by doing those things, there's actually been what I was describing before, some mindfulness, meditation, yoga, actually exercise also. Exercise also helps balance out your balance between your glutamate, your excitatory neurotransmitter, and if GABA, your inhibitory neurotransmitter, and helps reset that balance. So that's really important too. You want to be thinking about obviously having more of a lifestyle approach here at all times. So what I recommend for everybody is to have a sleep routine that they do every single night, no matter what, as much as possible. Because if you can do this, it's like the way I always describe it, it's like Pavlov and the dog. Pavlov's dog experiment is a very simple one. You ring a bell, you bring the food out for the dog salivates, and then after a little while you ring the bell and the dog salivates without any food there. And as a result of that, it's kind of a description of an automatic response. And so if you can tell your body that this is an automatic response, that I'm doing these things 15 or 30 minutes before I go to bed, oftentimes that'll be really great way to get people to fall asleep. Now, that's the falling asleep part. The staying asleep part is a little bit harder. And that's because you have people wake up at 3 o'clock in the morning and they'll be wide awake and have a very difficult time going to bed. And there's sometimes people will take melatonin at that point. Some people won't. I know there's controversy around melatonin as far as production, but the big thing I think is circadian rhythm reset, and also when you're doing your exercise. And so if you're seeing sunlight first when you wake up in the morning and trying to see in the sunset, and then avoiding bright lights in the evening. There's also controversy as whether blue blockers really matter or not. But I still think that certainly bright lights should be avoided in the evenings if at all possible. So that's a good way to help reset your melatonin as well as your cortisol rhythms. And I've also found that if people exercise too late in the evening, that can also screw up their sleep architecture and wake them up in the middle of the night. And so trying to work out earlier in the morning are some of the main things. And, then there's lots of other sleep hacks, as we know, but nothing's in a silo here, Joe, as you know. So you're thinking about how you can help people right now as you're doing all these things that hopefully will help them maintain, so they don't need supplementation. They don't need exogenous things. They can kind of do it all on their own.
Yeah. So the circadian rhythm is, you want to align, as you mentioned or alluded to, you want to align your sleep time with sunrise and sunset. So as we're recording this is the first weekend after the daylight savings time termination in the U.S. So it gets darker a lot earlier. Mm-hmm. So you mentioned waking up at 3. Actually, that's my I frequently wake up at 3, and I guess when I get up time, but I go to bed at 8.
Right.
So
So that's
that's
enough sleep then. Yeah.
7 hours. And
Yep.
then I wake up a little earlier. Today I woke up at 2. I think 2. Yeah, it was 2, but it was really 3 because of the time shift.
Sure.
So I did some meditation. Now, you had mentioned the breath work, and I couldn't agree more, but I'm wondering if you've looked into the reason that breath work works. Ostensibly, it's to increase your CO2 levels. And I don't know if you studied CO2, but that is like, it is good, because we should dialogue about that, because, I've done a deep dive with one of the leading breath experts, probably the best guy out there in the world, Peter Litchfield. And he teaches this, and he actually has a device that measures your CO2 levels, because you don't measure it, you're just guessing. And what he's a firm believer in is that most breathwork teachers are doing the wrong thing, because it's not about breathing mechanics. It's about kicking in automatically, autonomously, and getting rid of your bad breathing habits. That you can be doing these. You can be doing perfect buteyko breathing. And he's had a lot of practitioners and were over breathing all the time and had very low CO2 levels. So you have to be cautious with breathing, because if you have, and these breathing habits, they're established frequently at a very early age from some type of trauma, and you have a trigger and boom, you're into it. You don't even know you're doing it. So it takes a skilled clinician to assess these, and it's not widely known, but it sounds like you're aware of that. So I'm wondering if you can share your experience with CO2 levels and some of the strategies you mentioned, because it would seem like to me that the benefit of doing that is to raise your CO2 level, which is so dramatic. It improves your oxygenation in your body. And actually we should talk about this, because you had alluded to it earlier in your intro, that you do hyperbaric oxygen therapy. Right. You're one of the top experts out there on this. And I'm wondering, in my mind, it's almost malpractice not to use CO2 in that airflow to compensate for it.
Well, yeah, you make some very interesting points here, because I'm an oxygen guy. I've been an oxygen guy for a decade, doing hyperbaric oxygen therapy and understanding how oxygen works. And it wasn't until maybe 2 years ago, when I met a couple of colleagues in the space as well, that let's call it the breath space and the CO2 retention space, where I truly started to understand that if I wanted oxygen to work better, I needed to make sure that I understood. CO2. I needed to understand how CO2 was working, because if you're hyperventilating, for example, you don't unbind oxygen from your red blood cells, and you can't get it to your peripheral tissue because of how you shift something called your oxygen dissociation curve. So,
because you're changing the pH.
You're changing the pH, exactly.
Yeah, you get respiratory alkalosis.
Exactly. So there's something called the oxygen dissociation curve, and this is a curve
the Bohr curve.
That shifts depending on multiple different things. The oxygen availability is one of them. CO2 is another one. There's multiple other things. pH in the body, it'll shift. And so you have to, when I think about CO2 now, I absolutely think about it as not a waste product anymore. I used to think about it as, we just make carbon dioxide and we breathe it out. But the challenge with that is that CO2 has lots of other major effects, especially in the brain. And it causes vasodilation, for example. And if you have too little CO2, you're going to constrict blood vessels. And if you're constricting blood vessels, you're going to have a challenge with getting oxygen to the tissues that you need it. And so certainly I think a big part of breath work, the breath work that's working on CO2 tolerance is really, really important, because that's going to shift your oxygen dissociation curve. And then as a result of that, you're going to have a better parasympathetic and sympathetic balance, because you're going to be more tolerant to stress overall if you have more CO2 tolerance overall. So I 100% agree that I think a part of what's going on with breath work and balancing out your sympathetic and parasympathetic nervous system is CO2 tolerance. And then by extension, I think GABA is playing a role as we have more parasympathetic balance around as well.
Yeah, I just recently viewed a lecture that Ray Peat gave from almost 14 years ago. And it only had 2,000 views, so virtually no one has seen this. And it was all about CO2. And he shared some examples on how it might be the single best longevity agent of the naked mole rat. And anyone who studies longevity knows that they're a paradox, because they're about the same size as a mouse. Mouse lives 2 to 3 years, and these naked mole rats live like 30 years. It's crazy. And the speculation from Pete's perspective is that they dig these holes and then they cover the holes up, and they're living in CO2 concentrations of like 5%. And our concentration in the environment, I believe, is 0.4%. Or it used to be 0.3, but now we've got global warming.
I just know about it in parts per. Yeah, I just know in millimeters of mercury. I don't know it.
Yeah, that's right. Because you're a hyperbaric guy. But
yeah.
But so it's interesting that and some of the speculation why it works is it actually lowers the conversion of tryptophan to serotonin.
I didn't know that. Okay.
Yeah, that's one of the factors.
Yeah.
So, but I'm wondering if you've explored integrating CO2 to the oxygen. They actually, the divers have this. I think it's maybe 5% CO2 in their oxygen mixture. It has a name, Carbonox.
Yeah, they have a name for it. I know you're
yeah, I just don't recall the specific
yeah.
name, but it's a standard mixture that you can purchase commercially if you're diving.
Yes. So I haven't explored CO2 directly, like as a gas. I have used, and I'm working with CO2 tolerance with hyperbaric therapy. So working on, there's another really cool little reflex. I don't know if you've heard of it. It's called the splenic contracture or dive reflex. So what happens is that if you hold your breath for a period of time, it doesn't have to be too long, even just 30 seconds, even maybe a minute.
Your CO2 will go up big time.
Your CO2 goes up. And as a result of that, you have your spleen actually contracts. And as a result of your spleen contracting, you get extra red blood cells in circulation because the body's trying to get you more oxygen carrying capacity. So I'm using that clinically.
So it's a reflex. It's a reflex.
Yeah, it's a dive reflex. It's something that we were, when we were mammals in the ocean, that we would have.
And, I didn't know that was a mechanism that the spleen contracts.
Yeah, so spleen actually contracts. It's
increased CO2 is a vasodilator, so you wouldn't think of a constriction anywhere, but it's a reflex. So.
It's a reflex that happens. It comes from us being mammals in the ocean and needing more oxygen carrying capacity. So trying to get every red blood cell, we have a reservoir of red blood cells in our spleen, and that reservoir is emptied, or a significant amount of it is if we hold our breath, because the body's thinking, oh shit, we don't have any oxygen around. We have to get more red blood cells out to do the best we can to carry more. So, and that's something that I've leveraged in a hyperbaric chamber, for example. So if you have somebody do a breath hold before they go in the chamber, then they go in, they're going to have more oxygen carrying capacity when they do go in. But the big thing that I always think about, Joe, now after the last several years of talking to breath experts and doing this myself as well, is making sure people are not hyperventilating at all, right? Making sure that they're taking slow, deep breaths and not over breathing, because if they are, they're not going to be able to unbind the oxygen that we're.
You're 100% correct, but it's a huge problem, because Litchfield is not only an expert in respiratory physiology, has a degree in it, but he's also an expert in behavioral training, behavior analysis.
Right.
And that's the whole thing. All of this is unconscious. They think they're breathing slow, but a large segment of I cannot say it's the majority, but in many cases, they're breathing too deep. It's not shallow. And as a result, they're hypocapnic. Their CO2 levels are in the dirt. Even though they think they're doing it the right way, they go into this supposed relaxation response and their CO2 levels drop to like 20, 25. It's crazy.
Yeah, you can do some things. I haven't worked with any CO2 monitors directly, but I know they do exist. But I know that you can look at. I've got
one. I play with it all the time.
Oh, cool.
It's fascinating, because what I'm particularly intrigued with is I had a bad breathing habit when I was working out and exercising. And when you look at the monitor, you can actually train yourself to slow the breath down. You can see your CO2 levels. And I would go in like in the low 20s, and now I'm in above 40 when I work out. But it's a massive conscious shift in how you're training, because you think you're breathing heavier and more quickly and you're getting more oxygen, but it's the exact opposite. You lower your oxygen.
Yeah, nasal breathing is really important too. I think that's the other piece that people forget, is that nasal breathing is also really important when you're looking to increase.
Ideally, but it's not necessary. You can breathe normally with your mouth. It's not ideal because you're losing the filtering and there's other reflexes, and you dry your mouth and you're going to increase your risk of cavities. But you can still have normal CO2 levels with mouth breathing.
Yeah,
but I would never advise it for nighttime sleeping. That's for sure.
Yeah. I know that from a CO2 tolerance perspective, it's easier for nasal breathing in general, is what I've been told. Overall, especially if you're in exercise, you're able to increase your tolerance higher if you're nasal breathing versus mouth breathing. But
it may not be. It depends on the individual, because
Sure.
the only way to do is to measure it. You got to use these capnometers, and the capnometers will tell you without very precisely. It's just like you
Yep.
don't know what your blood pressure is. You don't know what your vitamin D level is unless you measure it.
Yes, you got to measure. I'm a big fan of, I mean, this is just in general. I agree with you 100%, Joe, that you really need to be measuring things. And that's the big things that I typically measure is on the metabolomic side. So I do a lot of testing with my own personal clients of looking at metabolomics and looking at vitamins, minerals, and nutrients and hormones and neurotransmitters. And if you don't measure, you really don't know, is what it comes down to. And then you have all these objective measures of looking at CO2, for example, oxidative stress markers, back to the other side. But I'm always thinking about these things on the hyperbaric side. I'm always thinking about oxidative stress levels, antioxidant reserve, energy capacity, vasodilatory response. These are things.
CO2 is one of the best ways to reduce AGEs, advanced glycation end products. And you know how it does it? It does it by binding to the protein. There's a carbono-amino residue that has lysine as the amino acid, and it binds to that. And it does it. It's not covalent. It's an ionic bond, but it's like a bulletproof shield and protecting that protein from being damaged, which is why you want to have your CO2 levels really, really high as you can tolerate.
Right.
In the 40s, for sure.
Right. Definitely in the 40s. I mean, you have to be a little bit careful if you have COPD, if you have...
Oh, yeah, that's a whole different deal, right?
If you have obesity, hypoventilation.
We're assuming normal lung pathology. Lack of lung pathology.
Yeah, because I always have to be careful who's going into a hyperbaric chamber. If they have untreated severe sleep apnea, they're morbidly obese, they have COPD, and they don't have a good ability to regulate their balance between CO2 and oxygen, because the people don't realize that what makes us breathe is not oxygen, but our CO2 levels. And so if you can't balance out your CO2 and oxygen levels, you can get into trouble in a hyperbaric chamber. But that's another indicator, Joe, as what you're saying, that why CO2 is so important. We don't breathe because of lack of oxygen. We breathe because of elevated CO2.
Yeah, it's a stimulus. And, I didn't realize this, but in most communities, the most common reason that people jump into an ambulance is because of CO2 dysfunction. The majority of people, actually, in most communities, because they get a panic disorder and they think they're dying.
Right.
They really, because, people aren't stupid. They know they jump in an ambulance. It's a big ass bill. I mean, it could even result in bankruptcy jumping in an ambulance.
Right.
So they're not going to be doing that frivolously, 100%. They only do it if they think their life is in jeopardy. And I mean, they feel that. I mean, it's just a horrible feeling when you feel you can't get enough oxygen, and they get into this, they get trapped, and it just builds on itself, and they can't get out of it. And it is a lack of oxygen, but it's because their CO2 is so low. Right. Because the curve changes in the wrong direction. It binds tighter, and the pH makes it harder to get the oxygen out of the red cell.
Exactly. So if you can't unbind your red blood cells with the oxygen, so you're gonna feel terrible. And it's interesting. Yeah. I haven't done it, but have you ever tried holotropic breathing, where you do hyperventilation for 30 minutes at a time and have a psychedelic experience? I mean, I'm wondering what the mechanism is there. It's interesting.
Yeah, I'm not a fan of it. I mean, you can definitely do it. It's certainly an alternative to some psychotropics.
Right.
I just think there's other ways. I much prefer meditation to do that. It's a lot more
from a day-to-day operations perspective. Yeah. And certainly I think meditation is higher.
I've been playing with my meditation. I did an hour and a half meditation this morning, and
I'm a big fan of meditation too. Yeah,
and I had the capnometer on, and my CO2 levels were rising. I think this is the reason why one of the major benefits of meditation is your CO2 levels rise.
Do you think it has?
I was running at 45 the whole time.
Yeah, I wonder if it has something to do with increasing theta and delta, and maybe even gamma, as far as in the brain and brainwaves. Because
I use a meditation app that's exactly what it does. It's brainwave entrainment and drives you into those rhythms. So.
Yeah, I'm a big fan. I mean, so I teach all of my clients to meditate. I mean, I don't make it too complex for many people, but there's lots of different ways to meditate. But this is a great way for people to reset on a regular basis, to, again, go back to the balance between your parasympathetic and sympathetic systems, right? And having a different perspective on all the thoughts and the things that you think you need to do, but all of them being an illusion, and just watching them kind of arise and pass away. And there's obviously lots of nice ways of doing this, and lots of different apps and lots of different programs. But in essence, if you can just watch your mind and observe it for a little while and see what's happening, and be amazed at what comes up, and then just let it pass, because there's a great Tibetan nursery rhyme that I like. It's like, we are the sky and the clouds are just passing like children, and you just watch them go, and they just keep going and keep going. They're always going to come and they're always going to go. Right. So it's something that I tell my kids every night before they go to bed too, is a nice way of reminding people. But I think that you're right. I think when people have these meditative experiences, when they have these, and they have like these peak experiences on meditation, they're very well maybe a CO2 piece of this.
I'm convinced there is. There's like no doubt in my mind. There's a deep, profound physical response in combination with the brainwave rhythms.
Yeah, because you can change. You can change your internal temperature, which is super interesting if you're like a really amazing meditator. And I wonder if that has something to do with CO2.
Probably.
It's super interesting.
I've played with that, but
yeah, you have your monks that can sit outside in 0-degree weather for hours or days and maintain their internal temperature.
You might want to play with picking up a capnometer and playing with this.
Yeah, no, I'd like to. It's been on my list of things.
I'll connect you with one of the best companies out there. Cool, they're not terribly pricey. I mean, as medical equipment go.
Yeah, but looking at the hypoxic training as well. So I've been looking at more of how to integrate that on the hyperbaric side a little bit, understanding the shifts.
That's right. Yeah, thank you for reminding me, because I did want to discuss it with, I was going to do it offline, but as long as you mentioned it, we can discuss it here. What you're referring to is IHT, or intermittent hypoxic training. I have a device. They're pricey. They're tens of thousands of dollars. And I do it, but I'm actually preferring meditation more now. I'm shifting, because it's hard to use the capnometer in that device, because you have this face mask on that gives you the oxygen at varying concentrations, like you're 10, 12,000 feet, maybe even 15,000 feet. And it cycles between that concentration, which is usually PO2 of 14% or so, partial pressure.
Less than that. Yeah, less.
Yeah, I mean, I don't want to go a lot less than that. I would not go.
I know. I'm just saying, I live in Colorado.
It goes down to 9, but it's dangerous down there.
Yeah.
And then you go up to 34%. You alternate between the two, and it has some profound impact. So, yeah, I've been playing with it for a little bit over a year. And
I think there's something to it. I think that the going low oxygen is very interesting, and for short periods of time if you're relatively healthy. I think if you're unhealthy, I think it could be a real challenge, because it puts on significant stress in the system. What you're looking to do here with intermittent hypoxic training is kind of throw on that stress a little bit, and then go to hyperoxia, or to increase the amount of oxygen, and then kind of flood the system as the body is shifting that dissociation curve that we were talking about before. So you're shifting it one way, like in the oh shit way, because you have 9% oxygen, and then the red blood cells.
Hopefully not 9.
You don't want to. Yeah. So in Colorado, I think we're at 5,000 feet. It's about 16% oxygen. So just to give a barometer for people. So, and then you shift it back to hyperoxia, and then your body gets excited about all that oxygen being in there, and you can utilize it better as a result of flipping it back and forth. And so we've been looking at how you can use that inside of in a hyperbaric world a little bit, and help with leveraging, but you have to be careful here, because it is certainly something that can be very stressful on the system if you're not doing this, if you're not used to doing the intermittent hypoxia. In a hyperbaric chamber, Joe, as you know, you can use something called an air brake, which is when you're breathing oxygen at a certain pressure, and then you stop breathing that amount of oxygen, just breathe the amount of oxygen in the chamber itself. So that might be, if you're at sea level, that's 21% oxygen at sea level, and then you're increasing it maybe to 90% with a mask or something like that. And when you go to 90% down to 20% or 21%, your body sees as a relative hypoxia. This is something called the hyperoxic-hypoxic paradox. So you can think about even just leveraging a hyperbaric chamber without even going fully hypoxic. So, I mean, there's lots of different ways to play with this, but I think the main idea really is, how are you going to enhance the ability of the body to increase mitochondrial function, and also mitochondrial biogenesis. That's one of the big things. And then what you're looking at there is probably recycling a lot of the mitochondria that aren't working very well. And that's what you're looking to do with one of the major things here. The stem cell release is another, angiogenesis or new blood vessels is another thing. These are all kind of things that are involved, I think, when you're looking at that hyperoxic stimulus. Yeah,
it's a stressor for sure. And just in many ways, I think the best stressor analogy we have is exercise.
Right.
And just like exercise, you really do not want to do aggressive exercise every day. That is a prescription for disaster. Do typically hard workouts 2 or 3 times a week is all you need. Anything more is going to be counterproductive. So it's kind of like the same with this. You don't want to do it that frequently. But I'm
Yeah, I
wondering
agree.
if you've looked at the hormonal responses to hyperbaric versus IHT, intermittent hypoxic training. Are they pretty similar, like with the HIF1 alpha and other responses? And maybe you can compare the two because it's really, this IHT isn't popular at all in the United States. There's very few centers that have it. It's mostly was popularized in Germany and Russia, and it's just now coming to the US. So it's hard to find a lot of details on it. And I've actually been going to interview a Russian expert in the next few weeks to get more details, but it's sort of an enigma to me right now. I wonder if you've studied it more deeply.
I mean, I've studied it. I mean, the challenge is there's no comparisons in the sense of I can't say that IHT is going to do X and hyperbaric therapy is going to do the same or more or less. I mean, my general sense of this, Joe, is that intermittent hypoxic training in a hyperbaric chamber, when you're going from high amounts of oxygen to regular amounts of oxygen, that is safer for most people, especially when they're starting, because it's not going to be as much stress on the system in general. So, but if you're relatively healthy and you're looking to make bigger gains faster, I think that intermittent hypoxic training, as you're describing with one of these machines, is probably going to get you there faster. And so there's a trade-off there. And so in many people that I'm first doing this work on, I'm usually thinking about, if I'm going to do intermittent hypoxic training, it's to be very mild. And what I've also realized is that this is from talking to many people in this world of intermittent hypoxic training, and then a lot of these guys are also in the breath work space as well. My friend Brian McKenzie, for example, who's a really great, amazing guy, is that you don't need as much of a hypoxic stimulus really to get the effect that you think you need. And this is still very early in understanding, but when you actually get HIF release is probably not as significant. You don't have to go to 9% oxygen to do that, is what it comes down to. So I think that you probably can get away with doing less intermittent hypoxic training and still get significant benefit. And if you're not as ready to go to the deeper pressure, the deeper or the lower levels of oxygen and make the bigger gains faster. So I think a lot of this is just is person dependent. And I think it really depends on what the goals are, right? If you're an elite athlete, or if you're somebody that's just trying to have like longevity and health span first, longevity second, of course, but health span first, then I think that's going to be a different permutation where I would be thinking differently as opposed to somebody that came in and said they wanted to win an Ironman in 2 years or something like that.
I want to put a warning in here because I realize some people might be confused what we're talking about when we say intermittent hypoxia training, because there's another form of that out there, ostensibly, which is like Live O2 would be an example of that, and I've had one on of those. But this is a totally different animal. That's a cheap substitute, and essentially this giant bag that literally might be 4 or 5 giant trash bags full of oxygen that you hold up in a plastic bag, which is not a good idea, because of the phthalates and things that you're breathing in like 15 minutes. So, and then this device is much more sophisticated. First of all, it's the oxygen concentrator is medical grade. It's very, very pure oxygen. The one in these like Live O2s is not. It is not hospital grade at all. And there's no sensory feedback. So you have a $500 PO2 meter. I mean, this is another medical grade pulse oximeter that's on your finger so that you set the thresholds. And if your PO2 drops below 80% or 84%, whatever you feel the safeguard, the machine automatically kicks on. So you cannot damage yourself. It's a safeguard. Right. I mean, it's people that train me on it. In some ways, it's like Wim Hof breathing, but with all the safeguards. Because it's absolutely controlled. There's no way you can get hurt because if you're doing it properly, you can bypass the safeties, you're going to kill yourself. But that's not a wise strategy. Mm-hmm. So it's a lot. The point I wanted to make is it's a lot different than what's generally perceived as intermittent hypoxic training.
This is with a lot more guidance and a lot more surveillance as you're doing it. Absolutely. And I know machines you're talking about. I know how expensive they are as well. Yeah. So it's definitely another realm. And I agree. We shouldn't be breathing out of plastic bags as much as we can.
Yeah. Well, I had one of those and I stopped that many years ago. It was just, and because you could exhaust, especially if you're going fast, you can exhaust it. And then probably when you're using it, you probably have a bad breathing habit, and you're lowering your CO2 level. So you think you're breathing all this great oxygen, but you're consuming it so rapidly that you're developing low CO2s, and it's absolutely counterproductive. So you
Yeah.
have to be very careful. You're playing with fire, and you don't even know it. That's the danger.
Yeah, I think as we were discussing earlier, I think the main ways that most people can do this is learn the ways of CO2 tolerance. And there's lots of different ways of doing that. I'm sure, Joe, you have lots of recommendations there. I have
A
some.
capnometer. That's the only way to know.
Yeah, for sure.
Otherwise, you're fooling yourself. It's so many people, professionals who teach this. I can't tell you the number of people who thought they were doing the right thing, trained breath professionals, and they had low CO2 levels.
Yeah, I definitely need to check it out, because I think what I try to do, and look, all my patients and clients that I work with, whether I'm working on their GABA system or hyperbaric therapy, and because for me, my whole approach is a very foundational integrative one. I'm always looking for ways.
Oh, that's a good point.
Yeah.
You were talking about metabolomics and trying to find tests. So the latest data show that likely 95% of the population is metabolically inflexible.
Right.
AKA insulin resistance. So I'm wondering if you regularly measure fasting insulin levels. That seems to be the best biomarker for insulin resistance.
It's definitely one of the ones that I use when I'm looking at hormone optimization for my clients. I do use fasting insulin, and I do the HOMA2IR measurements as well.
Mm-hmm.
Which is
what is that now? The HOMA2IR? What is that?
It's just a way to calculate insulin resistance. It's a calculation that you can use looking at.
What are the other variables?
Fasting glucose and insulin level, basically.
Oh, okay. So you take those two and you get
it's just a calculation. So you can.
So fasting insulin by itself, and fasting insulin is cheap. I mean, it's not an expensive test. You just have to fast.
Yeah.
So
you're right.
What are the ranges you've seen in your practice?
I mean, you see things all over the place, and I've had even like elite athletes with low insulin levels that are crazy. That actually they become elite athletes just to maintain their insulin response, because they don't have enough insulin around, which is pretty unusual but pretty interesting. But I've seen everything from very, very low insulin to very, very high.
What's the lowest you've seen?
I think I've seen less than 2? I think it was 2, somewhere around there. So I think it's usually, I think the scale goes from 0 to 13. 3 to 13 is normal or something like that. I think if I have to look at the exact scale.
Interestingly, it's thought that carbohydrate restriction will lower your insulin levels, right? I mean, that's conventionally believed by most physicians, I think. So I got my carbohydrate levels up to 500 grams. And I don't recommend that for everyone, because you need a fair amount. You have to have muscle mass, and you have to be doing a lot of movement. Otherwise, that's going to be way too much for a lot of people. Most people need about at least half of that, though. And if you're getting less, it's a problem. But guess my insulin level. I just did it last week.
What was it?
Fast. 1.4.
That's low.
No insulin resistance.
Well, that's the thing. You don't have any insulin. I mean, it's very interesting. Yeah, with that much carbohydrate floating around, it must be everything else that you're doing. But I mean, in general, we have people that are much higher on the insulin resistance scale. And you're right. I think 95% of the population has metabolic dysfunction, which means they have mitochondrial dysfunction. And if your mitochondria aren't working, you can't think, you can't exercise, you can't do much of anything very well for a very long time. And this is why we have such it's just an epidemic of people with brain fog, and especially in the world that we are in now. Because if you don't have mitochondria that are working, you're going to see it very easily and very quickly in your brain, especially. That's where you're most outside of your muscle tissue and your heart and your liver. So I think it's great that you're looking at that. It's definitely one of the markers I look at all the time. Levels.
Well, I think it's imperative because it's an epidemic, and it really is at the core of one of the primary reasons. It's really a marker. It's not maybe not the cause, but it's certainly a marker.
Yeah.
Because I used to believe it was the cause, but I was confused. I used to believe high glucose was the cause. And no, it's insulin. No, it's not insulin. It's the reasons that the insulin is resistant to begin with, which has to go to the mitochondria. And the mitochondria are messed up because you're getting the wrong fuels.
Yeah, you mentioned muscle mass too, which is a big one, right? If you don't have muscle mass, you don't have any reserves for your glucose that you're taking in from your carbohydrate. So you need to have muscle mass to be able to add a reservoir for these things. If you're taking as many carbs as you did for a period of time, you don't have any muscle mass, you're going to get in trouble. Overall.
Big time, because you'll have too much glucose that you can't store.
You can't dispose of the muscles.
Muscle is a sink. It's got the glucose receptors on the cell membranes.
Right. And Yeah. That's why it's really big for people, especially as they get older, to make sure they're maintaining their muscle mass and their protein intake. And that's a big problem with intermittent fasting in general, is that people don't get enough protein, let alone carbohydrate restriction. And I know that there's controversy on that side and how you've changed, but in essence, I think the bigger issue is protein for most people. If they're not getting enough, they're going to get sarcopenic as they get older, which means that
Yeah, definitely. But I think they're both a big issue. I think that potentially the carb restriction maybe even more so, because you're going to have chronically elevated stress hormones, glucagon, growth hormone, cortisol, epinephrine, or not dopamine, adrenaline. It's also called adrenaline.
Yeah.
So, and they get what's called, there's some clinicians who call it adrenaline dominance. And interestingly, you know what some of these clinicians use to treat adrenaline dominance? Aside from carb restriction, getting healthy carbs on board.
Sure.
They use progesterone.
Yeah. I've actually heard that.
Seems to work really good as an anti-stress hormone.
It does. Yeah. It can do that for sure. I mean, it also really works well for BPH if you put it as a suppository, is what I've heard as well. So.
Really? Yeah.
Yeah. It's interestingly enough, but then you can't get erection. So there's that problem. But, at least you don't have a big prostate, maybe. I don't know. Well, different things here, but I think
it goes back to a lot of people believe that nitric oxide is so important and useful, but actually I don't know what your view is, but a lot of people are looking at it as a toxin, and you need some for sure, but the primary vasodilator in the body is not nitric oxide; it's CO2, it's carbon dioxide.
Yeah, there's controversy there. I'm not sure where I find myself at this point, Joe. I've heard your take on this before. I know I've heard obviously the other take of as well in various ways. So
you need some NO. You definitely do. There's no question. It's an important modulator, important signaling molecule.
Yes, and I do. And hyperbaric therapy depletes it. Interestingly enough, so that's why you have. That's why I have mild vasoconstriction when you're in the chamber. So what I try to do actually is to mitigate that vasoconstriction sometimes before people go in, because I do consider that as maybe from a therapeutic efficacy perspective. But in general, I find all these arguments really interesting. I find the arguments with Ray's work.
It's an argument, a discussion.
Yeah, I love it. I think it's so great because you should always be questioning what you believe. You don't believe what you think, and everything you think is an illusion anyway, is what I always tell my patients.
Yeah, that's true. That's true for life. I mean, that's one of my guiding principles.
Yeah, that's why that's
all
why
an illusion.
Yeah, that's why I think so many people respect your work, Joe, is because you're always willing to question what you believe and change. And I think that's the way I grew up as well. As the son of a chiropractor, as I mentioned, it was there was never any gospel. It was like, whatever is the information here, this is what we go with, and this is how we go. And so right now, for me, that's the way I practice, and I've created a whole sort of foundational work that I do with clients, and the work that I think about from the GABA system and parasympathetic and sympathetic and CO2 and oxygen. These are all always evolving things. Yes. And like, if you asked me 3 years ago about CO2, I'd be like, oh, it's a waste product. So,
yeah, for sure.
No. So this
now we know better.
Yes, and that's the thing, right? And so
no, you would have said it's the primary contributor to global warming.
Okay. Well, that must be what you believe now, or you believed 5 years ago, or 10 years ago, whenever. I don't know.
All right. So if people are intrigued with your view on how to get healthy and do it in your view approaches, how would they find you?
Yeah, so I think probably the easiest way is my website is drscottsherr.com, DRSCOTTSHERR.com. I have various other locations. There's a nonprofit that I was mentioning earlier that I'm a part of called Health Optimization Medicine in Practice, or homehope.org. And that's an educational platform for doctors and practitioners if they're interested in learning a new framework that's not functional medicine, that's really focused on optimizing cellular health and gut health and looking at neurotransmitters and GABA and things like that. And I have a couple of other companies that make products in this space that people are interested in. They can find me on Instagram at Dr. Scott Sherr, and they can find all those companies and links to those there too.
Well, great. Well, thanks for your work. You keep up the continuing challenging the mainstream.
Let's do it.
Thanks so much for watching. Remember, hit the like and subscribe button so you can get more videos that can help you and your family take control of your health.